if you're planning to give this year or next year, should involve the mistakes you are going to make, and hopefully you will take some valuable tips which will help you with your preparation and get you the target rank. I'm sure most of you are here with the intent that, okay, surgery is a very big subject. How are we supposed to manage it? Some of you must be in internship, like Ritik here is already an intern. Some of you must be entering internship. Like I can see so many faces who would have just given their final exams. So this is all about me. Most of you know me from before, so there is nothing new. But now you will see a different kind of preparation compared to how it was for MBBS exams. Because it's a little more competitive, target oriented, and it's not as easy as you felt giving an MBBS exam was. So let's get started. Right. So I guess most of you now must be interns or entering internship. And some of you entered your MBBS 4-5 years ago when you were the COVID batch, one of the unlucky batches. And then you also had CBME pattern of learning. So first 2 years was getting the hang of it. You may have had offline classes only. You never had real classes. And when you came in third year, you had clinical subjects where questions were a little too difficult because it was a new pattern. 2-3 years ago, your seniors had a lot easy in the MBBS. Aap log ka was a little more challenging. And of course, by the time you reached final year, you got a grip of things. You were like, okay, we have to study medicine and surgery and obs and peds and ortho and allied subjects, derma, psych, so many things. So at some stage in final year, you would have felt, I just want to finish it. Okay. I don't really care whether I get an awesome score. As long as I'm passing, I am fine. Just God help me pass the exam because my aim is NEET. It's not entirely wrong to have felt that way, कि चलो मेरी aim तो entrance ही है. But some things in that journey could have been done better, but we are not going to think about that now. We are going to look ahead as to what lies ahead. Because if you are entering internship or you are going to give NEET this year, you have a very critical window in which there is time enough to make a difference. So we are today in 15th Feb, and this year's NEET is 15th June. So March, April, May, June, 4 months, big amount of time. And if you are appearing in 2026, then though you should definitely take a lot of tips from what I'm about to tell you in a very big subject. And I don't think I need to emphasize it is one of the deciding subjects, goes without saying. So two categories of students I feel would be here. One is entering internship or finishing internship, or some maybe even post interns. And some are MBBS students. My focus mainly is going to be towards interns, post interns. But if you are an MBBS student, then also you should get some tips on what you should be doing in these 2-3 years of MBBS if you have left. Now, how is life different? The first reality check that you need, because every year the date of the entrance changes. Last year it was August. This year it is June. Next year I don't know when it will be. It can be even March or April, because 2-3 years back it was the first Sunday of March. Okay, so NEET 2023 was the first Sunday of March. So don't take it for granted that entrance is going to be in June alone. It can be a few months earlier also. So let's assume you are preparing for 2026 and your internship is about to start, which is what I see most of the familiar faces here. कि हमारी internship शुरू होने वाली है. What are you going to, how much time do you have and what needs to be done? There is a simple formula that you should be aware of. It is called the 631 formula. If you will see any toppers interview, they always talk about this indirectly. 631. What is the 631? Your first reading should take 6 months. Your first revision should take 3 months. And your second revision should take 1 month. That's 10 months. Because that is the time most of you are going to have if you are going to give NEET next year. If it's this year, it's a different story. Then you have 4 months to go. But if it is next year, you have this 10 months of realistic preparation. Don't think, sir, we are only in February. And even if it is next year in March or April, I still have over a year to go. You don't, because you have internship. And internship is obviously going to keep you busy. So you don't have full days to study. You have calls, you have emergencies, you have heavy postings, medicine postings, surgery posting. So usme to you're not going to get full study days. So what approximate window of preparation you have is 6 months for first, 3 months for second, and 1 month to revise. And you have 19 subjects. And okay, all of you must be using some source to study, I am sure. Like I teach on cerebellum, so I interact with students who are preparing all the time. So I get an idea of how much have they studied and how good are they in surgery. Sources are all good, but you should know how to use them. So the first thing in your mind is you should know how much time you have and what is first reading going to be, what is first revision going to be. Now, if I say I have 6 or 7 months for first reading and there are 19 subjects, that means in a month I have to do 3 subjects. Okay, because 3, 6 are 18. So maybe a little more, 19 subjects, 6 to 7 months. Now, when I say 3 subjects in a month, it means I need to do 1 big subject and 2 small subjects. Big subjects are medicine, surgery, OBG, patho, pharma, PSM. These 6 are the 6 big subjects for an entrance. Medicine, surgery, OBG, PSM, patho, pharma. So don't think anatomy, oh, such a big subject. Short subject. However you want to put it. Micro, you have to count it as a short subject. Pediatrics is a short subject. You can't say big subject. They are not. Because in your scheme of things, they have to be fit into a short subject window. तो अगर ऐसे सोचोगे, in a month on an average, you will have to do, let's say, surgery plus ortho plus anatomy. That is 1 month of preparation. It sounds a lot to do, but I am giving you the actual timetable that you have to keep at the back of your mind. So you're like, sir, is it possible to do surgery and ortho and anatomy in 1 month along with internship? Obviously, it's not, which is why the next part is what you should get in your mind clearly. So now I will tell you how should you study surgery. But first get in your mind that if you are appearing next year, then you only have about 15 to 20 days realistically for a big subject and maybe a week for a small subject, along with internship. If you are a post-intern, it's a different thing. And if you are giving the exam in the next 4 months, then you have to make your schedule accordingly. That I have 4 months to go. So maybe I should finish my subjects now quickly so that I have 2-3 months to revise. Now let's talk about surgery. First, if you are entering internship or you are in internship, assess how much you know surgery. I'll give you an example. When I teach on cerebellum app, most of the people there are either interns or they are post-interns. And when I teach them surgery, because I'm given maybe 7-8 days to teach them if I'm teaching them offline, they expect to be taught everything from the basic. And trust me, from the basic means when I teach them hernia, I have to tell them hernia means there should be a defect, there should be a sac, there should be contents. Then I will tell them what is inguinal canal, what is direct hernia, what is indirect hernia. Now, if you are at that stage in your internship, then obviously studying surgery in 15-20 days is not going to be possible. Then you need to dedicate longer time. But if you are someone who has done your MBBS surgery properly from whatever source, whether you learned from me or whether you learned from some app or whether you went for offline class, however, if your surgery is built well and your other clinical subjects are well built in your MBBS days, then it will be a little easier because then no one will have to tell you what is a hernia. Then you can straight away just revise. Oh, this is herniorrhaphy, this is hernioplasty, and this is the most common complication of open hernia. This is the most common complication of laparoscopic hernia. So first, you need to know where you stand in each of the subjects, like surgery, and then you need to know how many days I have to give. If you can't decide this, then you will never make a plan. And if you can't make a plan, in the end, you will be absolutely at a loss. It will be chaotic. You can ask your seniors, the ones who didn't get a rank. This is where they would have reached. They would have reached 3 months, 2 months before the exam. कुछ सब्जेक्ट अच्छे से आते हैं, कुछ सब्जेक्ट एकदम पानी में है, बड़े सब्जेक्ट पानी में. That should not be the case. So when you are starting, when you are making the plan, you define your time frame. That okay, in my MBBS, I was not at all good at surgery. I watched many videos. I felt I knew it. But when it came to exam, I had to just mug it up. When it came to internship and I started solving the modules, I could not make head or tail out of it because everything seemed new. which happens with many people, because MBBS, you are not really under pressure. You are like, okay, I want to finish those so many hours of videos. I have attended 5-day offline surgery. I know it. But reality strikes an internship. So if you want to compensate, you have to define how many days. A good student, like some of the names I can see over here, who I know personally, should not keep more than 15 days with internship. Now, if I have 15 days, what will I watch? How much to attend? If you are someone who goes for offline classes, then surgery offline classes, any class you go for will have 5 days of offline surgery. Okay, which will be like from 9 a.m. to 9 p.m. or 9 p.m., 9 a.m. to 8 p.m. Basically, your whole day is going to go. So those 5 days are gone. Baki, you're left with 8 to 10 days. So first you decide how much you're going to watch. What do you do in the balance days? So what people feel in any subject is these are the things that you need to do. Okay, I've put on most of the obvious things that a student should consider when you're studying the subject. Like I should either do the videos, live class, along with the notes. Nowadays, people use ready-made notes, but if you're not someone who wants ready-made notes, you can make when you watch the class. You have every subject Q bank, separate PYQ modules, PYQs, previous year questions. A lot of people have ENDs. You have subject-wise tests and you have GTs. This is the minimum thing that we know is there. Now you tell me, if I have to do 15 days miss surgery or even 20 days miss surgery with internship, how much of this can I realistically do? So I'll tell you what people do in internship. They start with the videos. First, some people think we will do the main videos. Most of the apps offer this. I hope you are aware that you have main videos, which in surgery is going to be 70, 80 hours. And then you have quick revision or rapid revision videos, which is like concised into 20, 25 hours. But don't feel 20, 25 hours of rapid revision is easy, because that rapid revision is even more condensed matter. बहुत होता है उसमें, कम matter नहीं है वो. So even if I decide, chalo, I don't have time to watch 80 hours of live videos, I will watch rapid revision, 20 hours. उसके notes बड़े सारे. People try to do this and their 15 days are over. No Q bank solved, maybe a few topics here and there you'll solve in the Q banks. No PYQs, no ENDs, maybe a few subject-wise tests. TT तो देखेंगे, जब आएगा तब आएगा. Don't do this. Okay, biggest mistake. Don't do this, because you will reach a stage where you have tons and tons of watched videos and notes that you may have just seen once. You had no practice. And when you give the first GT, let's say you give it somewhere in the middle of the year, internship mein, chalo, I have done 50% subjects, now let's give a GT. Even the subjects that you feel you have studied, even in those subjects, you will screw up. And then the morale breaks. You feel shattered. Oh, now what to do? I tried to study, but I could never manage. I felt I was very good in surgery, but I'm not even getting 50% questions right. So what went wrong? And what should you do? Like, these are the things you feel you should do, but you should not. I'll tell you how you should do exactly. And first and foremost, you should have a target rank. By target rank, I don't mean a target rank in the sense I want to be in top 10 or I want rank 100. No. Approximate target. So don't say, sir, I don't know what branch I want. ठीक है, branch बाद में देख लेना. But rank decide करनी पड़ेगी based on how your MBBS days have been. If you are someone who has been consistently topping or top 5, then obviously your target rank should be top 100. If you have been coming somewhere in between, then you modify your target accordingly. Now, if I have a target in mind, like let's say when I was preparing, I was never a topper. Okay, I was a in-between student. So I wanted to do general surgery from the start. मेरे को तो हमेशा से MBBS के towards the end I was sure that okay, I want to do general surgery. And you know, nobody takes general surgery. मेरे time पे भी no one used to take. Now also nobody takes. So I knew that if I get 1000 rank, I will get general surgery in Mumbai, which is what I want. So even if you don't have such a precise target, you should have an approximate target and you have to work towards that. Don't keep a target of top 100, but prepare like you're preparing for 10,000, because then you're only fooling yourself. Once you have the target in hand, yeah, I want top 1000 rank. Then when you start studying the subject, you are going to study to suit, to get that kind of a performance in that subject. अपन क्या करते हैं? When we start studying, we see others. He has finished full 80 hours of surgery videos and he has solved a full question bank. And I want to do the same. But see, if he is someone who wants to come in top 10, it's fine. If he is someone who wants to come in top 1000, you don't need to do so much. Trust me, you don't. What you need to do is study based on what you are targeting. So if I'm targeting top 1000 rank, I will decide that, okay, in surgery, there is so much of matter. I will study these IMPs first. I will master them, which I can do in 15 days. Now, those topic selection has to be done by you. I can help you out, but it has to be done by you that, okay, I have to do these many topics. फिर क्या होगा ना? In 15 days, you study those topics. Once you study those topics, you have to per day make some time to practice MCQs. This is a must. Practicing MCQs ke bina, if you get a rank, it's a fluke, and if you don't get a rank, it's your fault. Then it's your fault. And this is what happens in everybody who gives a repeat. So जो भी repeat आते हैं, and when I talk to them ना, I ask them, what did you make a mistake in your first attempt? First attempt में rank क्यों नहीं आया? All of them say we didn't practice. Okay, मैंने कम से कम 5000 स्टूडेंट से ये पूछा होगा over the last 2 years. They all said हमने practice नहीं करी. We studied everything, but we never practiced. How you practice, it's up to you. So you have all these choices. You can practice from QBank, only PYQs, END, subject-wise GT. See, in the start, you can choose important topics from QBank and PYQ. That's enough. You can do ENDs later in your revision cycle. But first, you have to get a grip of at least what you are going to practice. And most of the apps have excellent QBanks, but some apps have too many questions, some apps have less, so you can customize. But you have to dedicate 1 to 2 hours for practicing MCQs. Now, when I do this in my first cycle of surgery or first cycle of all subjects, then when I come to the second cycle, let's say in 15 days, I could not complete surgery because I was an OBGY posting and I had a lot of work to do. So I gave it some days extra. It took me 20 days and I still couldn't finish. Let's say I finished 60% of the portion that I had in plan in my mind. Stop at that. Don't go behind completing 100%. It should not happen that you are a master of 10 subjects, but you are nothing in 9 subjects, because easy questions you have to get correct. Tough questions, if you couldn't get, is fine, but there should not be a single question on opthal or ENT or anesthesia which was easy, but you didn't know because you never studied it. That is a crime. The biggest difference between a topper and a repeater is toppers are not topping in every subject. They are being okay in all subjects. Koi bhi subject will never be untouched because easy questions they will get correct. So this is the basic framework you need to have. Now, this whole thing, I'll tell you the IMPs of surgery, only surgery specific. This whole thing is surgery. Okay, there are more things, but एक slide में I could put only this much. If you put all of this together, so अगर आप सब जोड़ लो ना, it will become notes amounting to something that will take you 2 years to study. कायदे से this much you should study in third minor and final year. कायदे से, because that is a time to give time to subjects like surgery. But let's say you didn't do it. Let's say I just did and I forgot because I just watched videos, gave exams, I passed, fine. Now you have 15 days, 20 days. So in 15, 20 days, if you have to study all of this, do you think it's possible? It's not. What you need to identify is the IMP topics. I will give you the list if you want. I have it on a PPT, on a PDF of IMP topics in surgery for NEET PG and for IN-ICET. जिसमें से frequently questions आते हैं. So I'll give you a simple example. When I start with GIT, the first topic I study is esophagus. Esophagus is a huge chapter. Means it is one of the biggest chapters. And unfortunately, it's the first thing we study. So people can take 5 days to study esophagus, or they can finish esophagus in 5 hours. How will they finish in 5 hours? If they know that in esophagus, I have to study anatomy, achalasia, Zenker's diverticulum, C esophagus, and GERD, 5 topics. If any question comes from these 5 topics, I will get it right. That should be the mentality. कि इसमें से achalasia में से एक भी क्वेश्चन आया एग्जाम में, वो मेरा सही जाना है. But if they ask some question which is little offbeat, like pill-induced esophagitis, जो कभी सुना नहीं है. If you don't get it right, it's okay. But एकल is a question, if you don't get it right, it will hurt you in the exam. So what I'm trying to tell you is, from this big list of things, pick up what are must-knows first. If you are targeting an awesome rank, top 10 rank, then you should do a much more comprehensive studying. Like I know some people here who I can say safely that they are top 10 candidates. For them, you should do maximum. But if my target is not top 10, if my target is 500, then do IMPs. IMPs means topics which are frequently asked, and any question on that topic I should get correct. That's it. Another mistake people make many times is they start with GIT, HPV, trauma, urology, and then they are fatigued. So they feel this is 80% of the portion, 1, 2, 3, 4, which it is not. In the exam, ये सारे topics से questions come. And the funny thing is, ये जो last की 2-3 चीजें हैं, breast, thyroid, endocrine, pediatric, general surgery. Mark my words, general surgery. Any entrance you give, you are going to get 4 or 5 easy general surgery questions. And by easy, I mean very basic preparation, so you will get them right. In every exam it comes. They ask things like, they will give you a picture of a leg ulcer and they will ask you the etiology. And there are only 3 ulcers: ischemic ulcer, trophic ulcer, venous ulcer. Still people make mistake in that because कभी पढ़ा ही नहीं. GIT awesome पढ़ा है, wound ulcer पढ़ा नहीं है. In the last NEET, in both, so last year the NEET exam had 2 parts. Morning session was separate, evening was separate. In both parts, they asked a question on oral malignancy. And they were easy questions, not very difficult. But if I've spent all my energy on GI, HPV, trauma, I will never touch oral malignancy. And easy questions will be missed. Pleomorphic adenoma, they keep asking. People don't study. So the perspective has to change. The perspective is not completion. The perspective is I have to do based on my target rank as much as will get me the answers. I'll give you one more perspective. Whenever exam happens, students always give me surgery questions ka recall. And I collect normally 25, 30 questions come. Do you think I am able to answer all 30 questions of surgery? Answer is no. Even I can't answer. Even after doing surgery for almost 15 years, 2-3 questions ऐसे होते ही है जिसका answer I have to after the exam then check in Bailey. Oh, this was a question. Is this the answer or is that the answer? So if I myself can miss out, you definitely can miss out. So your aim is not even as a topper is not to get all 100% questions correct. Topper gets 80% questions correct in all the subjects. That should be your aim. You will top. 160 out of 200 correct, you are going to be in the top 10. So if I can get 80% questions correct, means I should know 80% topics perfectly, not 100% topics. So limited studying, but focused studying is what you need. And in surgery, general surgery, it is the Achilles heel of students. उसमें mistake नहीं होनी चाहिए, बिल्कुल ही नहीं होनी चाहिए. My aim should be 25 questions of surgery. If I get 20 to 22 correct, I am in top 10 rank. And the same has to be extrapolated to other subjects. These are the difficulties you will face. Some things I spoke about. Sticking to schedule. For an intern, it's difficult. So it will get pushed, which is okay. But a schedule has to be there. And you cannot take 2 months for a subject. You have to stop. Depending on the time you have allotted, you have to stop. Second is, sir, first reading, when I revised, everything seemed new. It can happen in some subjects, especially the volatile subjects, volatile topics will seem it's okay, which is why your information should not be more than. So whenever I teach any course, students always point out, sir, you taught this topic, but you never said this point, or you never said that point. And I am like, okay, you know, I didn't say that point. You can add it to your notes. Do you think you'll be able to reproduce it? Problem is reproduction. Everything will become chaotic if there is too much information, which you would have realized when you gave medicine surgery exams in final MBBS. आपने थोड़ी सारी की सारी medicine पढ़ी थी. You studied focused only. There your aim was to pass. Your aim is not to pass. Your aim is that focused studying should give me enough information to get the answer correct. Biggest mistake, no time for solving MCQs. You don't do MCQs. your getting rank will be a fluke. Otherwise, you won't get a rank. The biggest tip, if you want to take from me today, the biggest is point number 4, not knowing what to revise. So you know what students do, and I'll tell you real examples. They study surgery in their first reading, and then obviously whichever apps you subscribe, big notes, bundle of notes of surgery, 300 pages, 400 pages, pad liya, some mark hai. Or maybe you made notes in your internship or in your MBBS, some notes ready, notes are ready, job is done. When you come to revise, those notes are too much. I'm not exaggerating, they are too much. So what to do? Should I redo the notes? So what you do, you hunt for notes of other sources which are ready-made, which you have not made, which are ready-made. Shortcuts courses, easy to revise, like a lot of apps have them. So you use those. So you introduce a new set of notes which are concised, which are not made by you in your revision phase, and you stick to that. Then what was the point? It will all seem new. What I'm trying to say is, when you're studying for the first time, this I tell all the students who study surgery from me in final MBBS, that whenever you are studying, your aim should be, if I am reading achalasia from any app or any note or any book, even if I'm using a standard book, I should mark out what I'm going to revise when I read it again. So first time when I read achalasia, it was 10 pages, but I marked out the point so that it became 3 pages. First revision, when I will revise, I will only revise those 3 pages. If I get a chance for a second revision, in my first revision, I should further divide it. That 3 pages should become 1 page. So that in my last revision, I have only 1 page of achalasia to revise. Bus. This has to be done. So you can do it by people make fancy things, like they make tables or they make those mind maps, or there's an app called Anki. ये सब चीजें लोग करते हैं. You can choose whatever way of doing it, but the aim is, whatever source you use, first reading should be to demarcate. Okay, what am I going to revise? Because from 6-7 months of first reading to revising it in 2 months means, if I took 15-20 days for surgery the first time, second time I'm getting 3 days. अभी 3 days में पूरा 15 दिन थोड़ी रिवाइज कर सकते हैं. उतना ही मार्क करो जितना 3 दिन में रिवाइज करोगे. एंड डोंट से सर इंपॉर्टेंट चीजें छूट गई तो क्या? छूट नहीं है. सब कुछ तो वापस नहीं पढ़ने वाले. It's smart studying. It's not hard work. It is smart work. And everybody has fear of GT. So many of my students say, sir, I never gave GT because I was scared. That's on you. If you are scared, you will be scared at every stage in your life. You will be scared even when you give the main exam. Oh, answer A, K, B, A, K, C. You keep changing. So that fear has to go away. You can give the GT anonymously. If you are scared, there others will know. But there should be no fear. In my opinion, you should start giving 1 GT per month from the start of your preparation. Means if you are a fresh intern, you should start giving 1 GT per month from the start. And as you build on more and more subjects towards the end, you can go to once a week in the last couple of months. The idea of the GT is not to tell you where you stand. सब लोग आपको ये बोलेंगे कि your rank in GT is 20,000. तुमको तो rank आ ही नहीं सकती. That is a fear we have. मेरी 20,000 rank आई. GT was given 1 month before NEET and it was 20,000 rank. Does that mean my awqat is 20,000? No, it's not. GT is only for one reason. You give a GT to identify your weaknesses. Because if your rank is 20,000, there must be 2-3 subjects in which you screwed up badly, which others didn't. Identify those subjects and work on them. Give them a little more time in revision. That's how you use your GT. GT is not for getting more questions and more matter to review. It is for identifying your weaknesses. So people say, sir, पूरा दिन चला गया GT review करने में, not needed. What are you reviewing? You already have the notes. You need to review your weaknesses. Okay. ऐसा करोगे ना तो problem नहीं आएगी. Now, I put this slide for a reason, because people run too much behind information and facts. Too much. Like, sir, आपने ट्रेकियोएसोफेजियल फिस्टुला पढ़ाया लेकिन आपने उसमें वो वाला क्लासिफिकेशन नहीं पढ़ाया, या you taught this but उसमें आपने वो नहीं बताया. Because those things are not asked anymore. What they are asking are things which are fairly clinical. If you are an MBBS student, you should make a particular note of this. And if you are an intern, fresh intern, then you should be aware that these are the things which may be asked. So keep your eyes open when you go for posting, when you go for work. What they ask is not most common cause of varicose veins. They will ask you, last year they asked, test of saphenofemoral incompetence. Okay, and they give options. This is a test, this is a test, this is a test. It's not. ये कोई भी ऐप के नोट्स पे नहीं था. अभी आया होगा because now it's a previous year topic, but it was not there. It was there only in your MBBS books. It was there in S-Das. Last year in NEET, they gave a photo where there was a stent in the ureter, and they asked the question, how is the stent put in the ureter? And the options were cystoscopy, ureteroscopy, ultrasound guided, ऐसे कुछ. Everybody said it is put by ureteroscopy. Ureteroscopy करके कुछ practically होता भी नहीं है. Ureteroscopy is done for ureteric stone removal. Actual answer is cystoscopy. You put the cystoscope in the bladder, you see the ureteric opening, and you put the stent. Why did nobody know this? It's because it's not there in any book. It is something that you should have seen. Anybody who has seen a single ureteric stenting would know it is put by a cystoscope. एक बार आपने देखा होगा. And see, many of you are from government colleges, private colleges, where there is good work, where there is urology work. कभी ना कभी तो आंख पढ़नी चाहिए. अगर आंख नहीं पढ़ी, then these kind of questions will kill you. Means it won't allow you to come in top 100. These kind of questions will push you from 100 to 1000. If you are okay with 1000, then you can ignore these kind of pure clinical questions. But ऐसे question आते हैं, parotid swelling का question था, where they gave the clinical finding. They said person has a swelling on the jaw. This is the consistency. What is the diagnosis? These you can't get by just mugging. So what I'm trying to tell you is your basic knowledge, basic clinical knowledge concepts will get you answers for most questions. Most questions. You don't need to take your level of डेप्थ टू लाइक एकदम ही गहराई तक, क्योंकि वो क्वेश्चंस तो आ भी गए ना, कुछ फायदा नहीं है. Last year in IN-ICET, they asked one very tough question. They asked something about bile duct injury का classification, which nobody knew. Those are not something you need to worry about. Those are like छोड़ दो, माफ. You don't have to worry about those questions. You have to worry about the expected normal question. अगर आपने वो भी कर लिया ना, you won't get a top 1000, you will get a top 100 rank. That's my main message. So don't make these blunders. Don't study randomly. You have to make a plan, dedicate days. Either you make it based on whatever app you are following, or you make your own schedule. But a schedule has to be made, which you will keep changing. You won't be able to stick to it, but you will keep changing. So you have to modify. Don't run behind hundreds of sources. There are too many things in the market. Stick to whatever feels good. You can use different sources for different subjects, but for a particular subject, you should have only one source. You can't say I will do surgery from cerebellum also, and from marrow also, and from somewhere else. फिर खाली surgery होगी और कुछ नहीं होगा. One source for one subject. If you want to do a decent job, don't keep reading notes and watching videos. You have to make time to revise, and you have to make time to solve MCQs, and you have to delineate what you are going to revise. Revise करने का ही the पूरा खेल वही है. Revision में कौन पढ़ता है? First 6 months what you study is not going to decide. What will decide is what you revise, and what you revise is based on what you are prepared for revision. It's like a war. It's like you are going for a war, and today what you are doing is you are building your physique, you are targeting your aim. That is your preparation. The war is going to be the last 1 month of preparation, where you have the correct guns, the correct skill set. And then when you go for the exam, everything will hit the target. Okay. Something, if anybody here is in MBBS, UGs, because I got one question from that also, that if you are in third year or final year, you have to give time to the subjects, because this is the only time you have time. Internship, you won't have time. And by time, I mean, you need to make time to learn the concepts versus just finishing the videos. Because concepts are, fortunately or unfortunately, what are being asked. Last year's NEET surgery, morning, evening, both, had only concepts and image-based questions. They gave images which were very easy if you knew it. If you didn't know, you could never guess it. They asked questions. There was an image that a person had the testicular pain, you did the surgery. It was an image of testicular torsion. Such an easy question. People didn't know. कि पता ही नहीं है टेस्टिकुलर टॉर्शन क्या है. They know everything about anatomical problems of testicular torsion, but torsion क्या है कभी देखा ही नहीं है. So if you have time and if you have appetite, spend time little bit in seeing patients, medicine, surgery, OBG, and definitely in surgery you should see at least the minor procedures. Lipoma, fibroadenoma, lymph node excision. If you don't want to go and see any case, any laparoscopy, laparotomy, it's fine. At least minor procedures you should see. And at least you should do some topics from Bailey and Love. At least. I'm saying at least the IMP topics. Mark them. Okay. If you have the appetite, if you are targeting, if you are like, nee, mere ko nahi karna hai, my aim is to get 5,000 rank, I just want the rank, then you don't need to do so much. Then you just do passing level work, but passing level work is a gamble. Okay. IMP topics from standard books is possible. I'm not saying do Bailey cover to cover, it's not possible. But at least important topics, head trauma, chest trauma, abdo trauma, intestinal obstruction, ऐसे ही there are 7-8 topics, वो आपको करने चाहिए standard books. Remember, these points, entrances are heavily based on clinical subjects. Medicine, surgery, out of 250 to 60 questions are going to come. Don't say last में देखेंगे medicine छोड़ दूंगा. If you don't study them now, you are going to repeat, and when you repeat, you will have to study them. Okay, which is non-emergency. उसके options हैं. There are non-emergency surgical branches. Those are not very hectic. Like I do bariatric surgery, not at all hectic. Not at all. Like in a month, I won't even have to do more than 5-6 surgeries because it's not hectic. But general surgery, GI surgery, you will be operating every day. That is hectic, and you will not want to run away. Okay. Shin has asked which books can we use for MCQ prep as third minor. So frankly, if you're studying surgery in third minor, your focus should not be on MCQ prep. It should be on reading standard books and learning the concepts. And MCQ prep should be a top up. And whatever source you have, you can stick to it. There is no one source better than the other, but it should be like not more than 10% of your preparation. Your preparation should be collecting the matter, understanding it, seeing it, so that when you comes to internship and when you have to revise, you don't have to be taught hernia ka matlab kya hai. You should know what a hernia is and what is direct hernia, what is indirect hernia. You should only be focused on the MCQ part of it.
So there is one question sent in the Google form.
Hmm.
What all are the vital topics not to be missed or the last minute topics that should be read just a week before the NEET or IN-ICET?
So I have a list for that. I can share it with Ritik, and
Yes, yes.
he can share it on your group.
Yes, sir, yes. So there are a few questions in the chat box also.
Okay.
I will start from third year after reading books and lectures when we should start concising only from first read or after 2 to 3 reads.
You have to start concising from the first read, because even if you are not thinking about internship preparation and you're thinking about preparing for MBBS, it should still be that wherever I'm reading from, I have to demarcate what I will read it, what I will revise when I come to it again. So a demarcation has to be from the start. Otherwise, it will become chaotic. Otherwise, when you come back to it and nothing is marked, or if everything is marked, it will seem like it is new. सब नया नया लगेगा, फिर स्ट्रेस आएगा कि यार ये तो मैं पढ़ चुका हूँ. But if you see the markings, you will feel, oh, I have some idea of what I did.
Between university exam preparation and PG preparation in final year?
Your focus should be on university preparation, like I said, not for passing, but for getting enough concepts learned so that it will help you in your entrances. What I'm trying to say is concepts have to be learned. You can't start from scratch. We focus too much on PG preparation. So we start solving MCQs and start watching videos where we are getting information. But when it comes to internship, all that information is gone. And it feels like you're starting from scratch. That should not happen. So when you're, let's say you're giving your prelims. In prelims, you should feel that, oh, I studied surgery. I know these things. Like, itna mujhe aata hai. When I'm giving university, itna mujhe aata hai. That is the most important thing, because MCQs to aap kar hi loge when you're preparing for PG, because all whatever source you use for PG, for entrance, they will all teach you, they will all grill you. Most common cause of this is this, most common complaint. वो तो आपको पता ही नहीं. पर वो आपको ये नहीं बताएंगे बेसिक, फिर आपको लगेगा वो कुछ समझ में ही नहीं आया।
There is one question. Is there any alternative to Bailey and Love?
There are many Indian author books. The ones that most students read are Sriram Bhatt, SRB, and Manipal. I don't feel the choice of book is important. Frankly, I am not saying that compulsory Bailey ही पढ़ो, ऐसा बिल्कुल ही नहीं है. You should read books which you can follow. बट सर बेली से ही क्वेश्चन आता है ऐसा नहीं है, सब बिल्कुल ही नहीं है. अगर आपको बेली समझ में नहीं आया तो बेली से क्वेश्चन आ भी गया, आपको आंसर नहीं आने वाला. पॉइंट क्या है? अगर समझ, इफ यू कैन अंडरस्टैंड फ्रॉम मनी पाल देन नथिंग लाइक इट. Okay, few points will be less, but at least 80% things will be there.
Sir, someone is asking, could you please share overall cutoff for PG in Mumbai?
That is, overall cutoff depends on the branch you are thinking about. Branch, and are you okay with going to private colleges? Because if you go to private colleges, then the cutoff is much higher. If you're okay for deemed universities, then the cutoff is even higher. But deemed universities come at a very high fee. Like there are colleges in Mumbai, DY Patil, MGM. Fees are very high, between 30 to 50 lakhs per year. Government colleges depend on the branch. Like I would say surgery, open category, you can get in Mumbai colleges up to currently about 2000 lakh. All India, I'm saying. State quota is different. And they may change the state quota system now. There are things happening where the state quota system may change, domicile and all. But वो दूर की बात है, आप एक बॉल पार्क फिगर रख सकते हो, हर साल चेंज होता है. Nobody thought that, I'll tell you, last year there was one, when you think you get a rank one, it's the end of the world. ये मिलेगा. So last year, one boy got an IN-ICET rank one. He was my, and obviously in NEET also he got a good rank. So he took OBGY in his college from NEET, which means his IN-ICET rank one was wasted. ऐसे भी होता है. तो रैंक वन से भी उसको कुछ लेना नहीं पड़ा. Obviously, then the cutoffs change. But ballpark, you should have an idea of the branch that you want.
Uh, so there are no new questions appearing in the chat box right now.
Okay, cool.
Okay.
Cool. So I think I'll stop the recording now.
Yes, sir.
So thank you guys for having me here. I'll just stop the recording.
Recording stopped.
Okay. And any
Sir, there is one question from Dr. Syed Sohail. He says pediatric surgery as a branch in India? Question mark.
pediatric surgery is a very unexplored branch. So it is right out there. And definitely you can make something amazing if you have the appetite. It's very unexplored. Not many people are opting for it. और उसमें सीट भी easily मिल जाती है. Two people have written the same question. What are the factors that are the non-negotiables while preparing for NEET, which require you to prepare for a longer time, particularly in terms of mental health, staying motivated, and consistency? I'll put it in a simple way. You have to keep good company, and the people around you should motivate you. That is absolutely non-negotiable. You cannot be around people who have targets which are way higher than yours or way lower than yours. They have to be like-minded. They have to be preparing the way you are, and one should push the other, because it will be times when they do better and you do little worse. And they should motivate you. They should not feel like you are their rival. आजकल क्या है? We feel we are competing with everyone. It's not like that. You are only competing with yourself. You do a good job, automatically you will get what you want. So the way to staying motivated and having good mental health is the company that you keep. It should be the company who has a similar target. Final year, you don't need to give GTs, Richa. You don't need to give. Final year, you study final year. Study med, surg, OBG, PEDS. Now you have ENT opthal. It's a lot to study. You do that. Don't worry about GTs. GTs you give an internship आराम से, once your subjects are comfortable. Your posting of surgery happens, start attending postings and start reading any sources, find best subjects. So I'm going to take a session for final MBBS students also. I am frankly quite scared that we have to give 6 subjects. It's a daunting task. Names are most of your seniors here, like I see so many names who are close to Nikita and Kunal and Prathamesh and Sumita and so on. They had to give 4 subjects and they found it difficult. चार बहुत unity of the league बता दिए. तो मेरे को fear है I don't know how you guys are going to manage. It's not going to be easy. You have to work hard.
Sir, I have one question. So
Yeah.
currently the trend is to use the subscription apps and all, and like for the preparation of NEET PG, and
Yeah.
people are deviating from the clinical postings, like all the major postings as well. Clinical postings, yeah. Even the like the major ones, medicine, surgery, and those. So, is it helpful really in the long run, or like what should be the approach in a balanced way?
Now, what has happened since last year is just going from for app-based learning is not doing enough to crack NEET. People who did good, who had good exposure in MBBS only were able to answer the kind of question that I was asking you. So, थोड़ा clinical posting तो करना ही पड़ेगा, not because it's a need of the hour for future. फ्यूचर में तो आप जैसे तैसे सीख ही जाओगे रेजिडेंसी में, बट अनफॉर्चुनेटली इट हैज और फॉर्चुनेटली इट्स बिकम द नीड ऑफ द आवर इवन फॉर नीट. क्योंकि नीट में भी वो पूछ रहे हैं टेस्ट ऑफ सफिनोफेमोरल इनकॉम्पिटेंस, वो ऐप में नहीं मिलेंगे. सो ऐसे बहुत चीजें हैं जो अभी एप्स में आए नहीं है जो एग्जाम में आएंगे. बिकॉज I have been on both sides. I have been a teacher for MBBS and I have been teaching for NEET. So I can see the difference in what I teach there, and I can see the difference in students. And now I am seeing same kind of questions are being asked in NEET. तो बिना पोस्टिंग के आप यूनिवर्सिटी जैसे भी शायद पास हो जाओ, लेकिन नीट में एक्सपोज हो जाओगे. मेडिसिन सर्च ओबीसी में तो हो ही जाओगे.
Also, like just to extend that question, like for like, we attend OTs and all. So for our level as a student, as a final year student, or as an intern, so
Yeah.
how much are the OTs helpful?
In the long run or for entrance?
For the long run, of course, it is helpful, but with respect to entrance, what is
It is helpful. It is helpful because they are asking things which you would have seen in the OT and not read or watched a video of, which is how the exams have transformed. That's how things have become.
Sankalp, are there any questions left? Or we can wind up the session.
Wasim has to ask something. He's raised his hand.
Sankalp, can you unmute him?
Seen.
Yes, sir.
Holy.
Hello, sir.
Yes.
Sir, I am from Kolkata. I'm a final year student हुआ अभी. Sir, NEET PG मस्ट देना पड़ता है या मेरा टारगेट IN-ICET है, मैं कैसे करूँ उसको, कैसे इवैल्यूएट करूँ सर?
The portion is the same. खाली कुछ टॉपिक्स ऐसे हैं INI में जो थोड़े डेप्थ में पढ़ने पड़ते हैं, like hepatobiliary, urology. उस पे they ask question little bit in depth, but 95% portion is the same. आपको ज्यादा previous year topics देखने पड़ेंगे जो IN-ICET में ज्यादा पूछे जाते हैं, because there are fixed things that they keep repeating again and again and again. वो अच्छे से करने पड़ेंगे.
सर मेरा टारगेट सर्जरी है सर. मैं कैसे कौन सा सब्जेक्ट से बेसिक बहुत फोकस करूं सर अभी?
मैं एक लिस्ट इनको देता हूँ, वो आपसे शेयर कर देंगे कौन से टॉपिक्स पर फोकस करना.
थैंक यू.
ओके, ठीक है. Okay, Ritik, so I'll take your leave.
Sir, I request you to wait for a minute. We will click group photograph.
Okay. Shall I stop sharing then?
Yes, sir. I request all of you to turn on your camera for just a minute or so.
Turn on your cameras, guys. Please
We'll
be cooperative.
get a group photo.
Okay. Be nice, kind people. Don't behave the way you were with me last year. Some of you at least.
I can see 6-7 people.
ले ले जितने हैं उतने में ले ले, खुश रहे.
Yes, sir. Yes, sir.
ये लोग मेरे लिए भी अनम्यूट नहीं करते हैं कभी.
Okay, taking one more photo. Yes. Yes, sir. Yes, sir. Okay.
Okay, good.
Thank you, sir.
Thank you. Thank you, clinically involved team, and take care, guys. You need any help, of course, you can ask me. All the best.